Well, it's an inflammation of the vagina that can result in discharge, itching, and pain. The cause is usually a change in the balance of vaginal bacteria or an infection. Reduced estrogen levels after menopause and some skin disorders also can cause vaginitis. Well, before I discuss this illness in detail, let me tell you that I have launched my own website that is known as withbb.com. That is very informative website, and I post about different medical topics, and sometimes there are posts about some trending topics as well. Okay, so if you are fond of reading, then you can visit that website. Okay, now coming back to the this topic of vaginitis. Well, the most common types of vaginitis are bacterial vaginosis. This results from an overgrowth of the bacteria naturally found in your vagina, which upsets the natural balance. Yeast infections. These are usually caused by a naturally occurring um, fungus called Candida albicans. Trichomoniasis. This is caused by a parasite that is often sexually transmitted. Treatment depends on the type of vaginitis you have. Well, earlier on this channel I have already uploaded a short video about vaginitis, and today I am going to discuss this problem in detail. First of all, let me tell you the symptoms. Well, the signs and symptoms of vaginitis can include change in color, odor, or amount of discharge from your vagina, vaginal itching or irritation, pain during sex, painful urination, light vaginal bleeding or spotting. If you have vaginal discharge, the characteristics of the discharge might indicate the type of vaginitis you have. Examples include bacterial vaginosis. You might develop a grayish-white, foul-smelling discharge. The odor, often described as a fishy odor, might be more obvious after sex. Yeast infection. The main symptom is itching, but you might have a thick, white discharge that resembles cottage cheese. Okay. Well, on this channel, I have already uploaded a video about this yeast infection that is known as moniliasis, or you can say you can also call it as a candidiasis. Okay, so when I talk about my previous video, the link usually appears on the I button. Okay, so you can click that link and you can watch that video. So similarly, the link of candidiasis will also appear on the I button. Okay. Then comes trichomoniasis. That is an infection called trichomoniasis. This can cause a greenish yellow, sometimes frothy discharge. Okay, this is caused by a parasite. Okay, you should see your healthcare provider if you develop all these symptoms which I just told you. Okay, now I'll come to the causes. The causes depend on what type of vaginitis you have. Now I will discuss these individual causes. Okay, bacterial vaginosis. This most common type of vaginitis results from a change of the bacteria found in your vagina, upsetting the balance. What causes the imbalance is unknown. It is possible to have bacterial vaginosis without symptoms. This type of vaginitis seems to be linked to but not caused by sex, especially if you have multiple sex partners or a new sex partner, but it also occurs in women who are not sexually active. And the second comes yeast infection. These occur when there is an overgrowth of a fungal organism, usually Candida albicans, in your vagina. Candida albicans also causes infections in other moist areas of your body, such as in your mouth, that is oral thrush, skin folds, and nail beds. The fungus can also cause diaper rash. Okay. Trichomoniasis. This commonly sexually transmitted infection is caused by a microscopic one-cell parasite called Trichomonas vaginalis. This organism spreads during sex with someone who has the infection. In men, the organism usually infects the urinary tract, but often it causes no symptoms. In women, trichomoniasis typically infects the vagina and might cause symptoms. It also increases women's risk of getting other sexually transmitted infections. Well, on this channel, there is a video about trichomoniasis, which I have already posted, and that is very informative video. You can see that video also. Okay. Non-infectious vaginitis. Well, vaginal sprays, douches, perfume, soaps, scented detergents, and spermicidal products can cause an allergic reaction or irritate vulvar and vaginal tissues. Foreign objects such as toilet paper or forgotten tampons in the vagina can also irritate vaginal tissues. So these are non-infectious causes. Okay. Genitourinary syndrome of menopause, that is vaginal atrophy. Reduced estrogen levels after menopause or surgical removal of your ovaries can cause the vaginal lining to be thin, sometimes result in vaginal irritation, burning and dryness. Okay. Now I'll tell you the risk factors. Well, factors that increase the risk of developing vaginitis include hormonal changes such as those associated with pregnancy, birth control pills or menopause, sexual activity, having a sexually transmitted infection, medications such as antibiotics and steroids, use of spermicides for birth control, uncontrolled diabetes, use of hygiene products such as bubble bath, vagina spray or vaginal deodorant, douching, wearing damp or tight-fitting clothing, using an intrauterine device for birth control. So these are the risk factors. Now I'll tell you some complications. Well, women with trichomoniasis or bacterial vaginosis are at a greater risk of getting sexually transmitted infections because of the inflammation caused by these disorders. And now I'll tell you some preventive measures. Well, good hygiene might prevent some types of vaginitis from recurring and relieve some symptoms. Avoid baths, hot tubs and whirlpool spas. Avoid irritants. These include scented tampons, pads, douches and scented soaps. Rinse soap from your outer genital area after a shower and dry the area well to prevent irritation. And do not use harsh soaps such as those with deodorant or antibacterial action or bubble bath. Wipe from front to back after using the toilet. Doing so avoids spreading fecal bacteria to your vagina. Other things that might help prevent vaginitis include avoid douching. Your vagina does not require cleansing other than regular showering. Repetitive douching disrupts the good organisms that live in the vagina and can increase your risk of vaginal infection. Douching won't clear up a vaginal infection. Practice safer sex. Using a condom and limiting the number of sex partners can help. Wear cotton underwear. Also wear pantyhose with a cotton crotch. Consider not wearing underwear to bed. Yeast thrives in moist environments. Okay. Now I will tell you about the diagnosis. Well, to diagnose vaginitis, your healthcare provider is likely to review your medical history. I mean, when patients come to us, we take detailed history of vaginal or sexually transmitted infections. Also, we perform pelvic exam. During the pelvic exam, we might use an instrument speculum to look inside your vagina for inflammation and discharge. Also, we can collect a sample for lab testing. Your healthcare provider might collect a sample of cervical or vaginal discharge for lab testing to confirm what kind of vaginitis you have. Also, sometimes we do pH testing. Well, your healthcare provider might test your vaginal pH by applying a pH test stick or pH paper to the wall of your vagina. An elevated pH can indicate either bacterial vaginosis or trichomoniasis. However, pH testing alone is not a reliable diagnostic test. Now I'll come to the treatment. Well, a variety of organisms and conditions can cause vaginitis, so treatment targets the specific cause. Bacterial vaginosis. For this type of vaginitis, we might prescribe metronidazole tablets that comes with the name of flagyl, that you can take by mouth, or metronidazole gel that comes with the name of metrogel that you apply to the affected area. Other treatments include clindamycin cream that you apply to your vagina, clindamycin tablets you can take by mouth, or capsule you put in your vagina. Tinidazole that comes with the name of Tindamax and secnidazole that comes with the name of Solosec are taken by mouth. Bacterial vaginosis can recur after treatment. Okay. Now coming to the treatment of yeast infections. While yeast infections usually are treated with an over-the-counter anti-fungal cream or suppositories such as miconazole that comes with the name of Monistat 1, clotrimazole cream, that comes with the name of Lotrimin AF, Mycilex, okay, and some other names. Yeast infection might also be treated with a prescription oral antifungal medication such as fluconazole that comes with the name of diflucan. The advantages of over-the-counter treatments are convenience, cost, and not waiting to see your healthcare provider. However, you might have something other than a yeast infection. Using the wrong medicine might delay an accurate diagnosis and proper treatment. And now coming to the treatment of trichomoniasis. Well, it's almost similar to bacterial vaginosis. We may prescribe metronidazole, that is flagyl, or tinidazole, that is Tindamax tablets. Okay. Genitourinary syndrome of menopause. Now I'll tell you the treatment of vaginal atrophy. Well, estrogen in the form of vaginal creams, tablets, or rings can treat this condition. This treatment is available by prescription from your healthcare provider after other risk factors and possible complications are reviewed. Non-infectious vaginitis. To treat this type of vaginitis, you need to pinpoint the source of irritation and avoid it. Possible sources include new soap, laundry detergent, sanitary napkins, or tampons. Well, this was my video about vaginitis. I hope you like this video. If you have any question about this, you can ask me in the comment section.